A community diagnostic treatment centre in the middle of a North London shopping centre, one of 160 across England. The aim, to bring tests, checks and scans closer to home.
If you catch it early, your chance of surviving.
And today the Prime Minister was launching the expansion of a lung cancer screening programme. Yet at the same time, the think tank, the King's Fund, has released a report showing that the UK has below average health outcomes because it spends a below-average amount on health care.
That's all just helpful, actually.
And even as the Prime Minister stood in front of one, the report found that the UK has fewer CT and MRI scanners than any other country studied.
Rolling out lung cancer screening will really help improve survival rates for lung cancer, something where we are behind other countries, but today's announcement will help fix that.
The report says life expectancy is second worst amongst the 19 countries studied. People who have a heart attack or stroke are more likely to die as a result than in almost every other country studied. Survival rates for many of the most commonly occurring cancers, including breast, colon, cervix, rectum, lung and stomach, were below average. A lack of beds, staff and scanners, weakened by years of underinvestment, was the conclusion. They compared staffing levels with the 19 major countries and found that the UK was in 16th place for doctors per head of population, behind France and Belgium and just ahead of Canada. It wasn't much better for nurses per head either. The UK was in 15th place, ahead of Portugal and Italy, but behind Canada and Denmark. And one reason, the authors say, is lower pay than in similar countries, New Zealand and Australia benefiting from fed-up clinicians. Last week, the junior doctors announced their longest strike yet over paying conditions. They'll walk out for 5 days in the middle of July, asking for a 35% pay increase.
13 years of Conservative government have taken the NHS from its shortest waiting times and highest patient satisfaction in history delivered by the last Labour government to where we are today, which is the sick man of Europe, a national health service that can no longer claim to be the envy of the world and one that lets patients down despite the best efforts for staff.
However, the Prime Minister today did say that the long-awaited workforce plan will address some of those issues.
For the first time in its history, the NHS will have a long-term workforce plan to make sure that we hire the doctors, the nurses, and all the other GPs and medical staff that we need for the long term, reduce our reliance on foreign-trained clinical staff. Those are the right long-term decisions for the NHS, and that's what I'm interested in doing.
Next week is the NHS's 75th anniversary, with celebrations planned across the country.
What do we want?
Somewhat marred now by the backdrop of strikes, low staffing levels and record waiting lists.
Well, earlier I spoke to Siva Ananda-Siva, the author of the King's Fund report. I began by asking him whether he thought the main reason for poor health outcomes was down to a lack of investment.
I think funding for the health service is a big part of the current woes we have at the moment. If you look at what we spend on our healthcare service, it's below average per person compared to many of our peers. So it's not surprising that we have fewer hospital beds, fewer doctors, fewer nurses, fewer MRI and CT scanners. To a certain extent in healthcare, you get what you pay for.
Right. I mean, the government rejects that argument and they say, well, it's because of the pandemic. But your report shows that the COVID slowdown in the UK is much worse than in other comparable countries.
Yes, that's right. If you look at the number of cataract operations, knee and hip operations we did during the COVID period, it fell much more sharply in the UK compared to our peers. But I think it would be wrong to say that the struggles with the NHS are a COVID-specific problem. Waiting time targets for A&E departments, waiting time targets for routine operations in hospital were being failed far before the pandemic started.
But is that why they fell further during the pandemic than in other countries, in this country? Because it was starting at a sort of lower base, there were problems already.
If you speak to people from, for example, the German healthcare system, they talk about the excess capacity they have in intensive care units, the extra hospital beds, the extra staff they had. And as a result, they found that activity fell to a lesser extent during the pandemic, and they found it easier to catch up. If you run your system in the red zone like we do, it's no wonder that we're struggling.
Well, let's talk about some of the numbers, because you found that the UK has fewer doctors and nurses per 1,000 people than the average country you compared it to. The government's got this workforce plan coming, increasing the number of training places for doctors and nurses. Could that be a game changer or not?
I really hope it will be a game changer. And, to give credit, this will be the first workforce plan in a generation. I suppose the caveats are, firstly, we're starting from a really bad place. It's not only that we have fewer doctors and nurses than our peer countries now. We've been in that situation for a few years, so there's a big hole to make up. And the second thing is, how much can the government commit? If we're looking at 15 years to train a consultant, it'll be interesting to see if they can provide 15 years of funding to back up the projections and claims that they might be making.
Is the current funding model working, or would another system, for example, most of the vast majority of the countries you looked at don't use general taxation as a funding model. So is it not worth looking at a different model to achieve the aims you're talking about?
So that's a question that's been occupying me and a few other people for a long time now. And we looked at all the research evidence we could. And ultimately, we've come to the conclusion that there is no single model out there that absolutely nails it. The model we have in this country of an NHS funded by central taxation is quite efficient. It's a good way of getting money into the system. So I don't think fundamentally changing the model and adopting, say, the social health insurance of Austria or Germany is the answer. Unfortunately, I think you're more in the zone of 8 to 10 years of graft and incremental improvement.
In a way, are we not moving to a different funding model by default? Because increasingly, as the system fails, richer people are paying to get their treatment privately.
So that's right. Richer people can not exit the NHS, but almost duplicate it by using private healthcare. It's not only richer people. Increasingly, some people in this country are taking out loans to try and access that healthcare. The one thing I'd say is the way we've structured our healthcare system almost has natural constraints. There's only so much that the private sector can do in this country. But if we want a preview of where things might end up, dentistry is a good example, where unfortunately some people aren't getting the healthcare they need, the dental care they need, and when they get it, they're paying quite high sums. So I don't think that's the route we want to go down for our NHS.
How much, in your view, of the woes affecting the health service can be attributed to successive political failures on social care?
So I think, the failure to reform how adult social care is financed and more broadly supported is probably the biggest policy failing of certainly my career. And I think that's one area where, again, you look at countries like Japan, you look at countries like Germany, they've had that big grown-up national debate saying our population is aging. We need to have a social care system that's fit for purpose. Let's talk about where the funding comes from.
Do you have any confidence that any political party has the bravery to fix the NHS in the way that you think it demands?
So on the optimistic side, I've seen probably 3 significant proposals to reform adult social care over the last 5 years. Even though none of them have been fully delivered, I honestly didn't think that we'd get the Prime Minister of our country on the steps of Downing Street saying fixing social care is one of their priorities. So I think the level of promise... No, the level of promise is getting there, but you're right. It needs to actually happen.
Siva Ananda Siva, thank you very much.
Thank you.